Hello and welcome to this edition of The Doctor Is In. My name is Corey Burnell, and The Doctor Is In is a show we do with Dr. Randy Smart here in Calaveras County each month. And so Dr. Smart, thank you for joining us again.
Thanks, Corey. It's great to be here today.
Well, excellent. We're going to have some good information, and to our viewers who aren't familiar with the distancing and handshaking we're not doing because of COVID-19. So thank you for joining us under the circumstances, of course.
Absolutely. Thank you.
Well, our topic today is going to be poison oak and all things itchy, how our constituents and citizens here in the county can deal with those items that they come across in the wilderness. So why don't you give us a little intro on the subject today?
Well, let's start with this. There are things that bother people, like pain would be an example, maybe a mild hearing loss. And there's things that are kind of neurological that bother you. And if you take all those things and line them up, itching is the worst. It is. No, I'm telling you, Corey, it is the worst. So you can have a patient here in pretty bad pain, and you can have a patient next to him who really itches, and the guy with the pain will do better than the guy that itches.
Interesting.
There is nothing worse than itching, and you itch all night, you itch all day, you itch your skin off.
Which leads to bigger problems, right?
And you go crazy.
And, yeah.
You absolutely go crazy.
Interesting.
So itching is probably one of the most bothersome things we know. And so there are things in Calaveras County that make you itch, and I thought maybe we should talk about those.
Very good. Well, I have 3 children, and being in a rural county, we have had our battles over and over again with poison oak.
Oh yeah.
How to defeat it, how not to get it. Let's start with that item here.
Sure.
Yeah. The ways in which it's caught. Obviously, somebody rubbing up against it. How would we identify that for those who maybe haven't seen poison oak, for example?
So one of the things I wanted to convey to the audience is poison oak is much more common than you might normally think. If I were to ask you what percentage of people get poison oak, I would guess you would pick a number like 50%, 40%. The number is actually 80%. So 80% of us are sensitive to poison oak, and there's a lucky 20% that are not. So most people are sensitive to it, and it's really interesting the way it works. There is an oil, or technically a sap, in poison oak called urushiol. A little bit hard to pronounce, urushiol.
Sure.
And it is a particularly tenacious oil. It doesn't decompose very easily. It sticks around for a while. And we have these severe reactions to urushiol. And technically that's called a contact dermatitis, because you come into contact with urushiol and you're going to itch and form blisters. So the oil is particularly persistent and tenacious. And so, for example, it can be on other things you might not realize. It can be on clothing, and so whoever does the laundry can get it. It can be on pets, so you can go home after a long day, pet the dog, and go, where did this stuff come from? It can be on tools, so you may have a shovel or a rake or something you're using in the yard, and once it gets on that tool, it can persist for a long, long time, and we're talking more like months rather than weeks. So that urushiol oil is what we react to, and it doesn't degrade very easily, and you can, there are so many ways you can get this. So it's very common, and what happens is people become sensitized to it. So in your case, like your children, probably the first time they touch or get that contact with poison oak, they usually don't get it.
Interesting.
Their body becomes sensitized to it, and it's either the second, third, or fourth time where suddenly they get the rash and the itchiness. And by the way, I've got a great treatment for itchiness. But they get the rash and the itchiness, and then you stay sensitized really for the rest of your life. And as we age, we think that sensitivity gets better and better and better. So as you age, the outbreaks and the severity of it tend not to be as severe. I think probably that's because we learn very quickly not to touch it.
Sure.
Because nobody wants to itch, right? But also in terms of just your own immune system and the way it reacts as time goes on, you become you become more tolerant of it.
Interesting. Okay.
Yeah.
Well, now in the way of, since you bring up the subject of that oil and its tenacity, in the way of treatment when you are exposed to the oil, that regular soap and water doesn't really break that oil down, right? Or that sap, as you say. I mean, we've come across one product called Technu that claims to break the oils down so that it can be washed off.
Correct.
Are there particular treatments that you've come across that work effectively?
So my all-time favorite treatment is if somebody's got poison oak, the first thing I do is cut off their fingernails.
Well, okay.
Yep, cut off their fingernails. Because the problem is they itch and itch and itch. They itch the skin off, they itch the blisters off, and they itch themselves, not quite to death, but it's close.
Feels like it.
So the first thing I do is cut off their fingernails because they can still itch but not break the skin. So I'm not kidding, that really helps. It helps with any itchy rash to cut off the fingernails. The other thing you can do is maybe you're somebody who really values your fingernails cosmetically or socially. You could wear gloves, and occasionally we have patients we put gloves on. But the idea is you don't want those nails to dig into the skin.
Is that because it opens the skin up and gets the oils deeper, or is it because the oils are underneath the fingernails and then they scratch elsewhere and they spread it on the body, or both?
It's because you can spread it on the body, but it's also because when you break that skin, you become kind of a mess. I mean, it bleeds and it oozes. But you become at risk for other problems like infection and so to keep the skin intact as much as you can really, honestly, can be helpful. Like kind of tongue in cheek, but it can really be helpful, and we do that. That said, the best treatment ever is prevention. So it's recognizing that you're allergic, recognizing what poison oak or poison ivy looks like, recognizing that it can come on the pets or the tools, and so it's really that prevention piece. Now even so, like I say, you can get it on. It'll even the oil will even penetrate gloves. So you could be wearing gloves, even latex gloves, maybe even rubber gloves. And it can still get through. But it's that idea of recognizing it, knowing what it is, and once you learn that, you just stay out of it. Sometimes that's hard to do. I mean, you can have an occupation where, you're a logger, or, perhaps you work with one of the utility companies on the field. So sometimes that can be pretty hard to do, but it's really that prevention piece that becomes really important.
Well, you raise a couple of items I'd like to discuss before we get to the real good stuff, the itchy treatments and stuff. We'll make sure we get that in for everybody. But so if you do work in a profession where you're constantly, exposed to poison oak or poison ivy, and this is on your clothing, will washing the clothing with regular detergent break these oils down and get rid of them, or are you still at risk if you put that same clothing on?
No, that works. Okay. Absolutely. Hot water, detergent will really work. Okay. And it works for the clothes or the tools, but it also works on your skin. And so if you were to have an exposure, and I've done this many times, I get poison oak, so I have personal experience and my medical experience, but let's say, you're out there, you're doing something and you go, oh my gosh, that was poison oak I just touched, or just brushed across my arm, or even my face. If you are on the ball and quick enough, you can pretty much wash it off. Okay. So, but you got to start moving, and so what that oil is water soluble, but that water solubility changes pretty quickly when it touches the skin.
Oh.
So in the first 10 to 15 minutes, it's at least 50% water soluble.
Okay.
By the time you get to 30 minutes, you're down to 10%. So in my case, at my home, I can get right into the bathroom or the kitchen and hot water, a real soap, not a non-detergent soap, but a detergent soap, a real soap. And then what you want to do is you want to wash in one direction. You don't want to scrub it in.
Gotcha.
You don't want to rub it in. You want to wash in one direction, just like this.
Mm-hmm.
And you want to do that preferably within 30 minutes. Now, I've done this several times, and I get poison oak really bad. And I've been amazed that doing that really has prevented the outbreak. So that is a really good, and if you're in the field, hot water might be a little bit hard to do, but definitely you have access to water and soap, and that can be really helpful.
Mm-hmm. Now, you also raised poison ivy, and that was one of the things I was interested to know. Is there different effect or allergic reaction generally amongst people between the two? And is there different treatment or is it pretty well the same, whether it's poison ivy or poison oak?
Right, so you're kind of wandering into the topic of cross-reactivity. And there's things that will cross-react with other things because your immune system sometimes gets confused. The reaction to poison ivy and poison oak is the same reaction to the same oil. But interesting, there is cross-reactivity, and the bonus question for you is what is there in your kitchen that is got the same oil and the same reaction as poison oak?
Oh, I think I'm failing this bonus question. Yeah.
Mango.
Mango does,
yes.
No kidding.
The skin of mangoes has the same oil in it. So there are cases, and these aren't rare, where people will be peeling or preparing a mango and they get poison oak on their hands or their arms, sometimes even their lips, and that is a cross reaction to the oil in poison oak. So you didn't get the bonus question right, but it's a very real reaction, and it's called cross-reactivity.
Is it just that the oils in mango is at a much less level or intensity? I mean, much lower amount that we don't hear about it very often? Or?
Correct.
Okay.
Yeah, correct. The reactions are not as severe. But from as a doctor, you're always an investigator. There are so many times when people call and say, this is what happened, or this is what happened, and you start asking questions, and people have said, I was just working in the kitchen, I was doing a smoothie, I've got poison oak everywhere, did I get it off the dog, what do you think? And one of your first questions is, was there any mango in the kitchen?
Interesting. Well, now that kind of goes down the path of all things itchy that can cause itches that we have. What are some other things we'd experience around the house, in the yard, that may cause us to itch? I think, for example, maybe fiberglass or something like that we might work with in the garage.
Yeah.
What are some other things you frequently see?
So there's a couple things one of my most common calls in the office will be a call in kind of December, January, saying, Doc, I have the worst poison oak I've ever had, can I come in? I'm going, December, January, why don't you come in, let's take a look at it, and it ends up being shingles.
Okay.
So shingles is a blistering rash like poison oak. It can itch, sometimes it's painful, but it can itch. And so they will have shingles, and their take on it was that they have the worst poison oak ever, and we said, no, you have shingles, it's a different problem. Shingles is an infection, not an allergic reaction. But that's one of the common calls we get. There is a rash called Urticaria, which I think most people refer to as hives. And so hives is an allergic reaction, and you can get it to bug bites, you can get it to food, you can get it to just about anything you come into contact with. And hives is intensely itchy.
All over the body, or is it localized?
Or the rashes.
Oh, okay.
Yeah, and so often it'll form rings that come and go. Kind of the hallmark of hives is it comes and goes. So this arm will itch for a while and have this ringy rash on it, and then it goes away, but then it comes up on your shoulder and that itches. And so that's a problem we call urticaria, also known as hives. So that's common, but one of the things I see that is common and people just aren't quite aware of is called prickly heat. See, I can tell you're not aware of it.
Yep.
Right, prickly.
Is this the second bonus question I'm missing?
This is the second. So prickly heat is a summer disease or a summer condition. And what happens is if it's hot, and particularly hot with sun exposure, you will develop a rash that is bumps. And it can itch and itch and itch. And it usually doesn't quite come and go. It comes and stays while you itch, and while I cut off your fingernails, it itches. And that's called prickly heat. We don't really know why people do that, but it's common. And typically the patient will come in and say, what is this rash on my arm or my leg or my armpit? And that's called prickly heat.
Now, does either hives or prickly heat impact different demographics of people, at different age groups, for example, or is that something that as we age, we either don't worry about as much as when we were children, or we need to worry about more as we get older?
Yeah, so really good question. For the most part, immune reactions and allergic reactions are more pronounced in younger people than in older people. As we age, our immune systems get a little lazy and just don't do it. But that doesn't mean, you can be 70, 80 years old and have a huge allergic reaction. But as a general rule, the more impressive and the more pronounced allergic reactions tend to be teenagers, 20, 30, and as we get older, they tend to not be quite as bad. You do tend to see it in younger people, but I think if you were to go to a medical textbook, it would say all ages and all races, all demographics. Everybody gets hives. Everybody, I think, gets prickly heat. Everybody gets shingles. Shingles more common when you're older. And definitely everybody gets poison oak.
Yeah. Now, we talked a little bit about the topical treatment with the oils of poison oak or poison ivy. Are there topical treatments to some of these other itches that, obviously you're not washing oil off if it's hives or prickly heat? Is there something else that you would do to kind of mediate the itching?
Yes. There is, you've probably heard of calamine.
Sure, calamine lotion.
Kind of a skin-colored stuff you smear all over you. I'm not a big fan of calamine. I don't think it works particularly well. It helps. But it just seems like you're making a big mess. And back 50 years ago, that was all we had. So I'm not a big fan of calamine. There's also some oatmeal baths and oatmeal things you can put on you. I'm not really a big fan of that. But then there are things that I think are helpful. If it's over the counter, something you just want to go to the drugstore and buy, there is Benadryl Cream. And Benadryl Cream can be really helpful with those itchy rashes. And actually Benadryl pills can be bought over the counter. Benadryl is an antihistamine, and a lot of that itchiness is from histamines. Histamine is the itchiest thing out there ever, and your body makes histamine.
Okay.
So the Benadryl, either in pill form or in cream form, can be really helpful.
So the histamines, our body reacting to whatever this
part of your immune response.
Right, causing the itching.
Exactly.
And so an antihistamine causes our body's reaction to it to mitigate, to decline a bit.
Yeah, my experience with the Benadryl cream is it helps but they still itch. They do. So we have some very good topicals that are prescription for poison oak and other contact dermatitis, contact rashes, allergic rashes, and they are steroid creams. And one of them is called fluocinolone. It's also got a brand name of Lidex. So I use that quite a bit with patients. I will have them use Lidex cream on the rash, and that really helps. Particularly at night when you're trying to sleep. And itchy people don't sleep. Mm-hmm. And when you don't sleep, man, everything gets worse.
Right.
Doesn't matter what it is. So we often will prescribe fluocinolone or Lidex, a steroid cream. There are steroid pills, and sometimes we use those. I mean, the allergic reactions can be your face, can be serious. I mean, where you're disfigured, you're oozing. I had a brother that did this more than once. And so taking a medicine like prednisone can be the exact right thing to do, which is an oral steroid. Sometimes we can give shots. There are steroid shots we can give, but the answer is there's quite a bit we can do if we know what your problem is. Now, we don't want people being on a bunch of prednisone and walking through poison oak so they can go swimming or find the frisbee or whatever. I mean, that's not a healthy practice.
Sure.
but there is a lot we can do for poison oak right now. If you didn't prevent it and you're in the middle of it, most of the time we can knock it down to the point where you're not suicidal from the itching.
Mm-hmm. Right, and able to get some rest and not scratch yourself to death.
Right.
Well, teach us a little bit about what's different about a steroid cream or a steroid injection as compared to an antihistamine. How does that actually impact the body and treat the itchiness? How does it negate the problem?
So the allergic reaction is a series of reactions that start, with the initial reaction, and ultimately at the end of those reactions is the histamine release. So when you use an antihistamine, you're treating that very end reaction. Now, not all itchiness is histamine mediated or related to histamine. There are other things that make you itch. There's a list of about maybe 50 internal chemicals, if you will, that make you itch. Wow. So sometimes taking that antihistamine doesn't do anything because it's not histamine mediated. So what the steroids do is they go way back to this initial reaction. And so steroids are probably some of the strongest immunosuppressants we have outside of what we use for transplantation and things like that. So these steroid creams or steroid pills or steroid shots goes all the way back to the initial immune reaction and stops it right there, and they can be extremely effective. Mm-hmm. Extremely effective. We use them all the time.
Is it something where somebody has to get continual reapplication or additional treatment, or is it a one-off, come into the clinic, have a steroid treatment, and
it's a one-off.
One-off.
Yeah,
okay.
It's a one-off. And people that do that a lot, I say, look, I don't want you to be on steroids all summer long. So we got to find a better solution. If you're getting it from the job, let's talk about that. If you're getting it from the laundry, let's talk about that. So the one-off thing is fine. I mean, to take 10 days of steroids for the most part is not a problem. And I'll tell you, once people do that, they are hooked. They'll come back next summer and say, "Okay, I'm ready. I got it again. I'm ready to go." And
right.
and they're all. It's kind of funny. They're almost kind of demanding. They're saying, "Look, I need the steroids." Right. Exactly. What's frustrating about poison oak is there are so many allergic reactions we're able to treat with what we call desensitization. So like if you have a peanut allergy or a bee sting allergy, which are common, we can give you shots, and every week you get a different shot, and And that's designed to make your immune system accept the bee sting without reacting to it. It's called desensitization. And people in medical science have been trying to desensitize poison oak for years, and they cannot do it.
Interesting.
It just does. So it doesn't work. It absolutely doesn't work. Then there's no vaccine. There's no antibody. There's you're still stuck with the creams and the pills. There isn't anything we can do really stronger than that. Like Technu is very helpful. That's a great idea. There's another one called Zanfil, but those are real and those are helpful. I don't know about cost. Seems like everything costs a lot, but those can be really helpful.
Yeah, we found the Technu to be helpful with the kids, and we just kind of keep it in the bathroom with other soaps and treatments,
Sure.
Well, we just have a couple minutes left, but one thing you raised earlier and just kind of brought up again was how we avoid the poison oak, for example, and it being on pets, and I think that's where my kids most frequently get it is from their dogs. So in that case, are there bathing treatments that do you frequently bathe your pet? Is there particular shampoos that are effective at taking those oils off the pet? What would your recommendation be there?
Probably washing the dog after an exposure. I don't have any proof, Corey. If it were me, I would do that. Like say I'm on a hike and I know the dog got into it, I would put on a pair of gloves and I would wash the dog with a really good detergent shampoo.
Okay.
Dog may not like it, I don't care, but I would do that. I don't know that there's data to support that, but it makes sense. It makes sense that would work. And then if somebody is the laundry person in the house, they can wear gloves to do the laundry, and that's what we tell them. We say, look, wear gloves, be very careful. If there's anything that touches your clothes, then you're going to change clothes after you load the laundry, or be sure and use hot water. So those things can be helpful. And I think probably washing the dog. The problem is you can't tell the dog not to go into the poison oak.
Right.
They just won't listen to that.
And you don't know necessarily, you might not know they have it until they've given it to you. So
Been there.
Yeah.
Right.
Well, Dr. Smart, wealth of information. Again, we're trying to cram into half an hour, and I can't thank you enough. I know our viewers enjoy seeing you each time. So to our viewers, thank you for joining us, and Dr. Smart will be back in a month, or maybe more frequently. I'm not exactly sure, but I know I'm going to see you in a month. So again, the doctor is in with Dr. Randall Smart. Thank you for joining us, and enjoy the rest of your viewing.